Happy February, everyone, and welcome to Complete Hearing. I'm Dr. Sandra Miller. We're glad to be launching again Coffee and Conversation the first Thursday of every month, so welcome. As you tune in today, we're going to talk about brain health today. When you come to Complete Hearing, one thing we really want to focus on is you as a whole person. So we're not just here to test your hearing and give you some hearing aids. We go way beyond that. And we're super excited this month to be talking about something called Cognivue. And I want to give you some details on that. And at the end of this video, we're going to give you a little special promotion. So hang tight. What we talk about in regards to hearing is you don't hear with your ears. We've talked about that before. You hear with your brain. And what happens when you have hearing loss is that puts a lot of load on the thinking part of your brain. So the hearing part of the brain isn't working very well. And now the frontal cortex or your frontal lobe has to take on that information. And that puts a lot of load on the brain. The ultimate impact of that is that it affects your working memory. So as you're trying to focus and listen, you're not able to think and reason and understand as well. So the brain is very correlated to you understanding well, of course, for speech and clarity. So when you have hearing loss, there's a huge part of you that is not doing well because of that. Imagine then throwing on hearing loss and then some background noise or some more challenging environments. That cognitive load that you have on your brain is significant. As we age, everyone has a little bit of different reserve memory or working memory, and it's different for everyone. So we're super excited to be able to launch something new in our practice. This machine next to me is called Cognivue, and it is the first FDA-approved digital screener for cognition. Well, why does that even matter? Well, guess what? What we're doing right now for digital screening is nothing. We're doing everything on a paper and a pen, and then somebody interprets those results. And it's not truly an objective test. It's subjective because somebody has to score that and rate it. What's wonderful about the digital process to this is it takes the human element of the person scoring it out of it. And so when you sit down at this machine, it calibrates to you specifically, and it's going to adapt all the tests based on the pre-screening it does as you get set up with it. So we're so excited to have this in the practice. And so what I want to tell you is a little bit about this is going to become really part of our evaluation process as you come to see us. Sometimes you think, I'm just coming to Complete Hearing to get my hearing tested. And we want you to truly understand that hearing is just the small part of the sensitivity to sound. But truly, what is your brain doing with the information that it gets? We don't measure that until now. And so this is our ability to really to be able to understand when you are given information, how your brain sorts through that information and how your sensory abilities work in correlation with your hearing. It allows us to do so many things. It allows us to give you better counseling tools. When we sit down with you, we can tell you, we didn't just look at how you perceive sound, but we looked at how your brain perceives it and what it does with it. And then we can actually take our treatment plan and we can customize it based on this test as well. Many times my patients will come in and they'll say, well, I just don't understand. And we say, well, that's probably your brain not figuring out what's going on. Well, now we can measure really and give you a better idea of what's happening as you perceive sound. Not only that, but it allows us to do some really great things with the tools we have with inside hearing aids. So imagine that you come in and your cognitive ability may be slower, and we can adjust the parameters of your device to maybe not give you as much information. Slow the processing speed of the hearing aid to kind of match what your brain is doing. And up until now, for us, that's been kind of a guess. But now we just have this great tool that we're going to be able to add into our practice. So we're very excited about it. We're starting to try to educate our patients as well in terms of this is now available. And again, before what we were doing was just not really taking this into account. We were kind of treating the surface of your hearing, which would mean the peripheral part of it or how you perceive sound. But the underlying part is there's multiple parts to hearing. There's perception, and then there's understanding. And once you get it to understanding, what is your brain doing with the information we give it? So now we have this great tool to be able to help you be more successful, and that's why we're really, really excited about it. So it's called Cognivue, now here at Complete Hearing, brand new, and we're very excited to be featuring it. Cognition is something that people don't understand is tied to every other part of your health. So not just your hearing, but there are modifiable factors in your health that you can actually stave off some of these things with memory loss. And hearing is one of the top ones, believe it or not. One of the most modifiable risks, according to the Lancet. It's one of the top 5 journals in medicine. They did a study saying hearing loss is one of the most modifiable risks you can go ahead and do something about to help you stave off dementia. amazing. And then also talking about your overall health, whether that's what you eat, what you put into your body, the environments you're exposed to, background noise, just all the things that go into your overall health have an impact on your cognition as well. We're super excited to have everybody run through it and get a baseline. Studies are showing that when we do a baseline with Cognivue, we aid you with a hearing aid if you do have hearing loss. We test you 3 months down the road. What will happen is we're going to find that your ability to process is going to actually get better. And we're seeing this to be significant. And so now that studies are coming out that's saying, hey, if we do something about your hearing and help you hear better, your ability to process information is actually faster, and you're going to understand better, and you're going to remember better. So again, I can't even tell you how excited we are to have Cognivue in the office, and we are just getting started. We're looking forward to sharing our patient experiences with you, as well as our own staff experience with you as well. Cognivue, now at Complete Hearing, we are going to be offering this as a screening tool, and it's $25. So if you want to have your cognition screened, we're offering it this month for $25. It will give you a wonderful assessment of how your brain processes information in terms of your ability to spatially remember, word recognition. It's really a cool test. You got to come check it out. In addition to that, you're going to get a printed out report that tells you kind of where you are. And we're going to talk about your health. And we're going to talk about things you can do to improve your brain health. So give us a call. We'd love to have you come in and take advantage of this screening for $25. Have a great day.